Thank you, Chairperson. Non-bacterial prostatitis often causes irritative lower urinary tract symptoms, and upregulation of nerve growth factor and coenzyme 43 are considered to be cause of overbladder condition. Furthermore, NGF is known to induce activation of MAP kinase, leading an increase in expression of coenzyme 43, but it is not known whether change in the expression of nerve growth factor and coenzyme 43 and MAP kinase are involved in the development of bladder symptoms in non-bacterial prostatitis. In addition, beta is recognized as a therapeutic target for inflammatory diseases, including cystitis and prostatitis. So we investigated alterations in the expression of NGF, coenzyme 43, MAP kinase, and beta in the bladder mucosa using a rat model of non-bacterial prostatitis. Male SC rats were divided into 3 groups: sham group and formalin group and treatment group. Formalin group and treatment group rats were treated with 3-alpha diol or placebo from 2 days before prostatitis induction. In each group, cystometry was performed in a conscious condition on day 28 after formalin injection into the prostate. After cystometry, bladder was harvested for RT-PCR and immunohistochemical analysis. In cystometric evaluation, voiding interval was significantly decreased in formalin group rats compared to sham and treatment group rats. In immunohistostaining for macrophage marker F480, macrophage infiltration was shown in suburothelial area in the bladder section from formalin group rats. In RT-PCR analysis, the expression of NGF, coenzyme 43, and MAP kinase were significantly increased in formalin group rats compared to sham group rats. In contrast, the expression of beta was significantly decreased in formalin group rats compared to sham group. After treatment, the expression of these genes were restored. In conclusion, non-bacterial prostatitis induces bladder overactivity in association with MAP kinase, coenzyme 43, and NGF expression changes in the bladder mucosa, possibly attributed to prostate bladder cross-organ sensitization. Therefore, beta could be a therapeutic target for the treatment of irritative bladder symptoms in patients with prostate inflammation. Thank you for your attention.
Jeanette Potts from California. Which patients do you think that this rat model translates to? Which group of patients? So I just want to remind the audience that non-bacterial prostatitis represents 95% of men diagnosed with prostatitis, because only 5%, maybe even less, can be bacterial. And that just like we do know, I mean, we've kind of known this for a long time in prostatitis with that misdiagnosis, and we're now just beginning to realize that with interstitial cystitis, we have the same dilemma. Only 10% have a bladder disease, and with the men who have non-bacterial prostatitis, most of them have a non-prostate disease. So I would just caution people again, just as we discussed in the previous session, that this may not represent our human males who present with prostatitis symptoms, who do not have an infection and who probably don't have a prostate inflammatory disease. Thank you.
Okay, thank you. Dr. Lee from Taiwan. Do you do any kind of study about estrogen receptor alpha? So
Sorry, one more, please.
I saw your slide that it's mainly focused on estrogen receptor beta. So my question is that did you do any about alpha, or why do you do that? Estrogen receptor alpha.
ER alpha is reported to induce local inflammation in the prostate. So in this study, the expression of ER alpha is not significantly different between each group. So we don't evaluate ER alpha.
Okay, thank you.
Can I just clarify, did you measure alpha as well and chose to report just on the beta, or did you not measure alpha? Did you only measure the EB beta? Or ER beta, sorry. I think so.
I have one comment. I think in the clinical practice, if the patient presents with a non-bacterial prostatitis, he might also present with some lung symptom, especially may have some present with a frequency urgency. So the current model is a chemical induced maybe neurogenic prostatitis model, so they can cause the crosstalk between the prostate and the bladder. So I think they can cause the overactive bladder symptom in your model. So what you measure do the CMG at day 28, is that happen in 14 days after your formalin-induced prostatitis model? Earlier, can you find the same result, or just need to such a duration?
We didn't have a chance to evaluate for at 14 days. So we think it's an important next step.
Okay, thank you.
Thank you very much.
Thank you.